Hello everyone, Professor Cornish here. Welcome to part one of our presentation on evidence-based practices using what works in corrections. Now with this line of presentations, we're really going to be looking at the programming that is used in the correctional field. And really how we gauge the effectiveness of those programs. What makes a program effective and what makes a program ineffective. Now, first, prior to really diving into evidence-based practices, we need to know what they are and how they were created. Because every field has evidence-based practices. No, it's not just in the correctional field. No, there's evidence-based practices in other parts of the criminal justice field, any programs that are used. Also, like other programs that would be evidence-based would be, like, for example, problem-oriented and community-oriented policing. Those are evidence-based practices. You have evidence-based practices in the educational field, how we teach. There's evidence-based practices in the medical field, mental health, substance use. Every field has evidence-based practices. But exactly the definition of them, what they are, will change a bit depending on the field we're talking about. So we're first going to look at what evidence-based practices are in these presentations generally, and then we're going to go specific to what they are in the correctional field, whether it's institutional corrections or community-based corrections. Now, the generalized definition of evidence-based practices are the utilization of theory, research, and evaluations to guide the development, implementation, and evaluation of a practice. They're objective, balanced, and responsible utilization of current research and the best available data to guide policy and practice decisions. So with evidence-based practices, there are a lot of research that's done. So we know why these practices are effective. We know how they need to be delivered, how to be implemented. Evidence-based practices actually, once you have all the research done, they're actually pretty easy. Because after a while, the legwork's done. You've just got to make sure that whatever practice or program it is, you've implemented it correctly, you're delivering it correctly, and then you're periodically doing evaluations to make sure you're still doing what you need to be doing, that you're adhering to what you're supposed to with the program or the practice. Now, evidence-based practice involves an ongoing critical review of research literature to determine what information is credible, because not everything is. Like, you might have a study that was conducted on a particular practice or program, but that study might not have been done correctly. That study might be significantly flawed, as well as you really can't determine if something is effective just off of one study. You need more studies that are generating similar results in order to consider something evidence-based. Also, with the review of the research literature, you're going to also be looking at what practices and policies would be most effective given the best available evidence. And also, there's rigorous quality assurance and evaluation to ensure practices are implemented correctly. That you have the concepts of fidelity, and you regularly evaluate them to determine if they're effective. So like in the correctional field, for example, offenders, whether they are incarcerated or they're being supervised by some type of community-based corrections, when they initially come in, they'll have assessments done to gauge a baseline. And then periodically, they'll have additional assessments done to determine, are they changing? And to see, are there any additional programs maybe this person needs? But also those assessments too help determine with the program, are we doing what we're supposed to? And then you'll also have assessments done of the program itself. So we'll go from individual assessments of offenders to then broadening that to also assessments of the program itself to determine, is it doing what it's supposed to? Are we delivering it correctly? Did we implement it correctly? Now, evidence-based practices were first developed in the medical field to guide proper patient treatment. So you have every procedure, every surgery has a set standard of how it's addressed. You know, if you look at appendicitis, you've got specific ways that you determine if it's appendicitis, specific ways that it's treated. You know, the same thing with other medical procedures. So a lot of research is done. But then the concept of evidence-based practices spread into social services, mental health, substance use, educational fields. Now pretty much every single field out there has evidence-based practices. Now, exactly what makes an evidence-based practice in those fields is going to vary a bit. It's going to be different in the medical field versus the criminal justice field. Now, in regards to the criminal justice field, evidence-based practices really started to be used in the 1990s. Now, in the 1990s, the Office of Juvenile Justice and Delinquency Prevention, the OJJDP, they funded the development of blueprints for violence prevention at the University of Colorado. Now, Blueprints does have a different name now. Now, at the time, we were in Get Tough on Crime and the war on drugs. And there were a lot of new programs that came out for juveniles. A lot were focused on incapacitation, deterrence, and retribution. Deterrence for juveniles was one of the biggies. But during that time, we had all these programs out there, and we didn't know if they were doing any good. You know, are they effective? Are they actually doing what they're supposed to? Are we even helping these juveniles at all? You know, are we making any change with them? So that's why the OJDDP was like, okay, we need to do an assessment of the programs that are out there to determine what ones that are effective and why they are, and then what ones that are ineffective and why. So it involved the evaluation of multiple juvenile delinquency and violence prevention programs. Now, during this period, a little after the evaluation in the juvenile justice system started, the adult correctional rehabilitative programming started to be looked at too. So now we had programs in the adult system started to be evaluated to see what was effective and why, what wasn't effective and why. Now, prior to going any further, we do need to look at the programs that are used in the criminal justice field, because we do have a few different types. Now, the first is prevention. Now, prevention programs prevent criminality from occurring in the first place. And there's actually two types of prevention programs. The first is primary. Now, they target individuals across the board without really looking at what risk factors they have. Which risk factors are things that increase the likelihood someone will offend or reoffend. So we're not looking at really the risk factors, it's just we're doing the program across the board. An example would be DARE or other types of drug programs in schools. Those are across the board. A lot of schools also have bullying programs that are primary. Now, secondary prevention programs target specific risk factors in the target population. Now, with prevention programs, the person hasn't gotten into trouble yet. They're not committing crimes. But the goal of prevention programs is to prevent someone from engaging in crime. So with secondary prevention programs, you're going to be targeting individuals that they do have a risk factor that increases the likelihood they're going to be committing crime. And hopefully by addressing that risk factor, they're not going to. Examples would be in schools in areas that do have a lot of gang activity. You might have a gang prevention program in that school. Or you might have, let's say you have a program for juveniles who one or both parents are incarcerated. Having a parent that is criminalistic is a risk factor. So that program, even though those kids aren't getting into trouble yet, because they have that risk factor of a parent being incarcerated, you know, we want to address that risk factor. That way they don't end up committing crime, potentially. And there's a multitude of other types of prevention programs as well. Now, the second type of program that you'll run into in the criminal justice field is intervention. Now, it's used when criminality first starts to prevent it from escalating. So the person is starting to get into trouble, but we're going to intervene and stop the progression before it increases. And these programs are going to focus on the person's needs, their risk factors, their protective factors, which protective factors are things that buffer the risk factors, that keep someone from offending in the first place. Examples of intervention programs, diversion programs, where a person, first-time offender, commits a minor offense, we're going to divert them from the formal court process and have them go into a program to address risk factors and protective factors, so hopefully they won't continue to commit crimes. Other intervention programs, actually your specialized courts, whether it's drug courts, DUI courts, veteran court, domestic violence courts, etc., they could be classified as an intervention program. And there's a multitude of other ones as well. With juveniles, probation can also be considered both intervention and rehabilitative. Because with probation, you're trying to stop the criminality. So, you know, if it keeps progressing, that juvenile's going to end up in detention. You know, basically the juvenile version of being incarcerated. Depending upon their age and their crime, they could be tried and convicted as an adult. So probation does have with juveniles, does have a big intervention aspect. Now, the next type of program you'll have is rehabilitation, which that's providing programming and services to people that are committing crimes in the hopes that by addressing their needs, their risk factors, and their protective factors, that they're going to be able to sustain long-term change, that they're going to move away from criminal offending and be able to be a pro-social, conventional, law-abiding citizen. Then you have reintegrative programming. It's also called reentry programming. Because the majority of the individuals that are incarcerated do end up returning back to the community at some point, reintegrative programming is provided prior to and after their release from incarceration or for juveniles placement to help them sustain that long-lasting change and be successful in being in the community. Now, in the prison system, rehabilitative and reintegrative programming does go hand in hand. You'll have quite a few programs have aspects of both in them. Now, when analysis of current programs were looked at, they found a lot of ineffective ones and were able to determine why they were ineffective. Now, ineffective programs, ones that focus on specific deterrence. So basically, we're going to scare the crud out of this person so they don't commit crime anymore. Programs that focus on specific deterrence, shock probation, and like your scared straight jail exposure programs are examples. The reason why they're not effective if they solely focus on specific deterrence is you're not doing anything to address their needs, their risk factors, and the protective factors. You're just trying to scare the crap out of them is all you're doing. So after these programs were evaluated and it was determined that, hey, the reason they're not effective is you guys really aren't doing anything to address why they're committing crime. You're just trying to scare the crud out of them. The second generation ones were redone, and now they focus on addressing needs, addressing protective factors and risk factors, and that's increased their effectiveness. Now, other aspects of ineffective programs: increased control and surveillance in the community, such as your intensive supervision programs, like your ISPs, whether it's probation or parole. Programs that have an emphasis strongly on structured discipline and challenge. Your first generation boot camp and wilderness programs. Again, the reason why they were determined not to be effective is they were focusing so much on the discipline that they weren't addressing needs, risk factors, and protective factors. Now, the second generation ones do address those, and the effectiveness has gone up. Other aspects of ineffective programs are ones that are vague, they're non-directive, they're not structured. Now, elements of these ineffective programs, they show little or no effectiveness in reducing recidivism and creating long-lasting change. Also, the research found that sole reliance on risk control strategies they didn't improve long-term offender outcomes. So basically, if you just focus on like suppression, making sure this person doesn't have the opportunity to commit crime, and if they commit crime, you come in and bust them, not effective, because you're not addressing anything else. Now, the reason why sole reliance on risk control strategies were ineffective, besides you're not really addressing anything, and with these other programs as well, offenders, after they came out of these programs, reverted back to their previous behaviors. Like boot camps, for example, they had some short-term effectiveness. The first generation ones did after the offender got out of the program, but then they're right back in the same environment with no tools to keep themselves out of trouble, and bang, they went right back to offending, pretty much. So you didn't give them the necessary skills and necessary tools to keep from committing crimes. Now, the reason why with these ineffective elements, they were ineffective. As I stated, treatment wasn't combined with the control and supervision methods. You have to address those risk factors and those protective factors and any other need that person has. Now, I'm stating other needs because you might have, like if a probationer is homeless, you've got to address that because that is a huge risk factor for some other very bad outcomes. Or like, let's say you have a parolee that lost their job. Okay, we've got to address getting you employed again because you not being employed, not only is it a parole violation, but also it's going to create a multitude of other issues. So that's why I'm saying needs separate. Is they may not, the issue may not be directly related to crime, but if it's not addressed, you're going to have a lot of other bad outcomes potentially. Now, other aspects that were discovered in all the research that were determined to be ineffective, the program's not based on a sound conceptual model or theory. So in criminology, we talked about all these theories, whether they're criminological, sociological, psychological, developmental, etc. Your effective programs are based on a sound, proven theory. Also, other elements of effective programs, they're delivered to offender populations that they weren't originally designed for. So like, for example, if you have an offender that committed burglary, putting him in a sex offender program isn't going to be effective. Or if you try, let's say you have a program that was developed for low-risk offenders, if you try to put a high-risk offender in that program, it's not going to work because the program wasn't designed for somebody that's high risk. The program being implemented and delivered by unqualified, untrained staff. Qualifications and training are huge because if you don't have it, you're not going to deliver the program correctly. And you could have the most effective program, but if you have someone that's not qualified and not properly trained delivering it, and they're messing up, it's going to significantly drop the effectiveness down. Also, if there's too much focus on punishment and negative reinforcement. Some programs are very much based on like social learning and cognitive development. And if it's just you're going bad, 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 the person's going to go, well, heck with that. If you think all I'm doing is bad and I'm trying here to do what you tell me to, heck with this. Also, if there are poor attitudes by the administration, staff, policy members, and the public towards the program. And also, if they're unwilling to change from previous methods and ideology. An example of this, not correctional, but when community-oriented and problem-oriented policing first started to be used. Newer law enforcement officers that went through the academy after the programs were used by the departments, they were trained in the program. That's all they knew how to use. But you had like your old guard, you know, your law enforcement staff that were in before COP and POP were implemented. Some of them were like, this is soft on crime. This is BS. That could cause the effectiveness of community-oriented and problem-oriented policing to go down. Because if they're thinking it's garbage, it's ineffective, it's soft on crime, they're not going to use it or not use it correctly. And their attitude will go, potentially other staff will end up getting that attitude too. Also, poor attitudes and appropriate relationship of delivery staff in regards to the offender. Really, when you're dealing with offenders, you've got to have a middle ground. You don't want to come in too hard because then they're just going to hate you. And you're not going to really have any positive reinforcement. But the same token, if you come in too soft, you're not going to address when they mess up. You're not going to be holding them accountable. So you have to have that middle ground. Not individualized to recognize individual differences, such as their motivation to change, their learning styles, gender, crime, culture, etc., as well as their risk factors. And again, the burglar having to go into a sex offender treatment program that doesn't have any history of sex offenses. You're not individualizing that program, and that program will be useless for that individual. And probably a good chance it's going to increase the likelihood they're going to reoffend. No therapeutic integrity, meaning it's not implemented the way it was designed, it's not delivered as designed. There's not assessments to determine if the program's appropriate for the offender or not. Also, programs that fail to address the risk factors. And in part 2, we'll actually further go into risk factors, as well as I have some other presentations that go into risk factors as well. But you're failing to address risk factors, either eliminating them or reducing their adverse effects. And you're not doing anything to address the protective factors, either strengthening them or developing new ones. Also, you're not providing any aftercare and intervention services once the program's done. Whether it's the offender returns back to the community, or there are some departments, both institutional and community-based, for offenders that they've had that have successfully completed a program. They're now actually delivering refreshers on that program. Basically shortened classes to kind of, okay, you've been out of the program for a little bit. Now let's kind of give you a refresher to kind of help you be able to actually keep applying that program. And let's see if you've been having any problems, and let's see if we can get those addressed too. And maybe give you some hints. And now that we know what makes programs ineffective, we need to know what makes a program effective in the correctional field. Now, obviously, in different other fields, effectiveness and ineffectiveness are going to be different. Now, effective programs in the correctional, but also other programs in the criminal justice field as well. Correctional programs do go a bit more in depth, which is why this presentation is focusing more on them. But the program is based on a sound theory or conceptual model. And it provides multifaceted targeting of those risk factors. And they focus on responsivity, meaning that individualization. They're regularly evaluated through research and also analysis of outcomes. So we're looking at recidivism rates, we're looking at changes in offender attitudes and behaviors, etc. They have a set criteria for admissions based on risk needs assessments. Now, assessments are done during like the initial classification process, and then they're done ongoing at specific intervals. Now, that interval is going to be dependent on, and exactly what assessments are done, dependent on the department. They have an analysis of the crime and its severity, existing risk and protective factors, the assessments, especially like through the initial classification. You're going to be looking at education and vocational level, medical needs, mental health needs, substance use needs, etc. And based on the results of the assessment, then you'll start determining what programs are appropriate for this particular offender. Now, part 2 of this series, we're actually going to be diving further into conducting assessments in 2 elements of evidence-based practices, assessing actuarial needs, which is doing the assessments, and then targeting interventions, which is using the results of the assessments to determine what programs are appropriate for each offender. Now, other elements of effective programs. They're successful in reducing offender recidivism if they focus on reducing and changing criminogenic needs, which criminogenic needs are a type of risk factor. They're dynamic risk factors, meaning they can change. And also you'll focus on other risk factors as well, including criminogenic risks, which are risk factors that are static, meaning they don't change, but you could reduce the adverse effect of them. Just like if someone went through child abuse and neglect as a juvenile, you can't take that away, but you can reduce the adverse effect of that. Other elements of effective programs, they're structured, they're intensive, they're long in duration. Now, the length is going to depend on really how intensive the program is. Your low intensive programs, which are for your low risk offenders, they're going to be shorter. Where your more intensive programs for your higher risk offenders, they're going to be longer. We'll go into that in part 2 of the series. And also they occupy some of the offender's time. More intensive the program for the higher risk offenders, the more time it's going to take. They define problems that lead to criminal behavior and conflict with authorities. They select goals. So those of you who go into correctional case management, whether it's institutional or community-based, you'll be working with the offenders on your caseload to determine goals. You're going to be addressing your higher priority risk factors and needs first, and then you'll kind of go down the line. And also, you're going to be implementing new pro-social solutions, meaning pro-social meaning like law-abiding, appropriate behavior, those kind of things, to deal with difficulty in resolving conflict. And also, one huge aspect of effective programs is the offender being able to engage in role-playing and modeling through social cognitive training. This is where, now some of you that have had like criminology courses, you might be going, hey, that sounds like social learning theory. It is. Social learning theory is a huge theory, and other learning theories are huge in evidence-based practices in the criminal justice field, especially corrections, but they're in also prevention and intervention programs as well. Now, that's the end of part 1 of this presentation. As I stated previously, part 2, we're going to be going into 2 of the principles of evidence-based practices in the criminal justice field, which are assessing actuarial needs, so using those assessments to look at risk factors and protective factors, and then targeting interventions, which is, okay, now that we conducted these assessments and we know the results, we're going to be using them to determine what programs this offender is going to go into. And then part 3, we're going to be going into the remainder of the principles of evidence-based practices. So I hope all of you enjoyed the presentation. If you have any questions, comments, concerns, please feel free to contact me. Also, if there's any other topic you would like me to do a presentation on, please let me know. Now, I hope you guys enjoyed it, and I hope you have a good rest of your day and stay safe out there.